Hi again, I'm Dr. Jose Pereira. I'm a palliative care physician and Professor and Director of the Division of Palliative Care in the Department of Family Medicine at McMaster University. It is difficult to make decisions without information, especially when one is also experiencing very strong emotions while facing a serious illness. In this video, we'll provide some information that may help you and your family when facing a serious illness. How much information do we need? People have different preferences about this. Some people want lots of information, some not too much. Some want all the information up front, while others prefer to get it in smaller chunks over time. Let your doctors and family know what your preferences are. Most people want a fair amount of information, enough to help them understand the illness, what is happening, what treatments are available, and what the pros and cons of the various treatments are, and what care options are available. Sometimes we hear people say that in our culture or in that culture, people don't want to know what is happening, especially if it is a serious illness, because it may cause anxiety. The family may even ask that doctors not tell their loved ones that they have a serious illness or that there is a serious complication. We need to challenge this way of thinking. Research across many countries and cultures shows that in most cases, people want to have information about the illness. Withholding information from patients is unethical, unless the patient has clearly said they don't want information or only want limited information. At the very least, we need to ask patients what information they want, no matter what cultural background they're from. Think about it yourself. What type of information would I want when facing an illness? Most patients find information about the following most useful, and often want someone to be with them when receiving it. The disease and the extent of the disease, also known as the stage of the disease, the treatment options available, the anticipated benefits, as well as possible side effects of each treatment, and where the best place for care would be. Dr. Elizabeth Latimer, a Canadian pioneer of palliative care, once wrote that there are little, medium, and big questions that arise when facing serious illness. The little questions are the easiest to ask and also the easiest to answer, such as, what test is being done and why? Where will I get the treatment? Can I still travel? Can I still drive? Medium questions are important questions that are easy to ask, but the answers may not sometimes be that easy. They include, what is the illness and at what stage is it? What results will the different treatments produce? What impact will they have? The big questions are the ones that worry us the most, that keep us from sleeping, that we are often afraid of asking. But they are important questions to ask and to discuss. These are questions like, how serious is my illness? Will I be cured? How long do I have to live? Now, you're probably wondering why we talk of care and treatment approaches. Are these not the same? We use these words to make the point that the types of treatments we choose at any given time depends on the overall goals of care. During the course of an illness, and especially at diagnosis or when the disease recurs or changes, there may be treatments that can control or even cure a disease. Other times, however, a potential treatment may not help control the disease or prolong life much, but may cause severe side effects and negatively impact one's quality of life. In these cases, it may be a better option to forego such treatments and focus rather on a palliative care approach, where treatments are used that can improve pain and symptoms and maximize quality of life without causing bad side effects. But remember, in all cases, whether treatments to control the disease are possible or not, one can always do supportive and palliative care to improve the quality of life that is still to be lived. Sometimes, in fact, treatments like chemotherapy and radiotherapy in the case of cancer, and treatments to control diseases like heart, lung, and kidney diseases are actually useful palliative care interventions. They will not cure, but they will improve quality of life. And sometimes one can even live longer. The discussions and decisions about what care or treatment plan to do whenever things change is called goals of care discussions and decisions. In addition to having information about the disease and possible treatments, other important things also need to be considered. One of them is asking oneself, what is most important for me now? Living longer or living better in the time that I have? If the treatments do not cause a lot of side effects or lots of burden, such as needing special tubes or frequent visits to hospitals or labs or even hospitalizations, then the decision may be easier to go with the treatment. However, when the treatments do not prolong life and come with lots of burden, with serious side effects, one may opt to focus on quality of life instead of going through the treatments. It is important to be honest to oneself and to make sure that your family understand your wishes and goals. Sometimes patients may appropriately opt not to proceed with treatments, but families become upset by that, thinking that patients are giving up. Families need to focus on what is important for the patient. Advanced care planning is a very important topic, one of the most important pieces of information of this video. Advanced care planning is a reflection on what is important for us at the end of our lives. It also includes identifying someone who knows us well to make health decisions on our behalf and financial decisions when we are no longer able to make those decisions ourselves. Advanced care planning is about planning ahead to make sure that if we are too sick to make decisions for ourselves, the care we receive is what we would have wanted. It provides the person or persons we have identified to make decisions on our behalf with information they need. If there's been no advanced care planning, we can end up receiving care and treatments that are not what we want. In the absence of advanced planning, we also end up putting a lot of pressure on our family or friends who have to make very difficult decisions on our behalf without knowing our wishes.